Ориэл Флавин достаточно уникальный пациент, поскольку она обратилась к нам именно с целью хирургического лечения сахарного диабета второго типа и хирургической коррекции гиперхолестеринемии.
Feeling absolutely wonderful.
И смогли избавиться от этого тяжелого заболевания.
Very high standard. They have had such a lovely holiday in Moscow. They have. And I think that that's a bonus. And I think it would mean we will come back again.
Мы постоянно, пожизненно поддерживаем связь с нашими пациентами.
Hello, nice to meet you.
Before we start speaking, the main question is how are you feeling now?
I'm feeling absolutely wonderful. I don't feel like I've had surgery at all. I feel so much better. Before surgery, I had a little pain here in the right, and that's completely gone. So now I feel no pain, and I feel really wonderful.
It's nice to hear that.
Thank you.
Can you please introduce yourself?
Yes.
Say where you come from and if you don't mind.
Yes, that's fine. I am Dr. Oriel Flavin, and I was born in Ireland but came over to actually practice in the UK, in England. And I am now 47 years old. And today it's 2 weeks before my next birthday, so I'm happy to tell you I'm still 47.
Which is good.
Yes.
And how long have you had diabetes?
I have had diabetes for over 20 years. It was really discovered when I was trying to have a baby, and I had no luck. And when they did some tests, they discovered that I had another condition called polycystic ovarian syndrome. And then they did other tests which showed I had diabetes.
Okay, and we know that in Britain the medical science is perfectly advanced. And why did you choose this clinic?
Because when as a doctor, I was looking up the ways in which diabetes could be not just managed, but potentially offered a cure, a treatment that would last for a long time. And I came across Professor Yashkov's research studies, and as president of IFSO, I read some of his work and thought, this is so wonderful. Instead of having a disease which gets a bit better, gets worse, and is very difficult to try and manage with my lifestyle, I was very keen to see if I could approach him about considering me for some treatment.
К моменту операции ее вес был 51 килограмм, но в прошлом она весила больше. Ее вес доходил до 80 килограмм, собственно, на этом фоне у нее и начал развиваться сахарный диабет. В ее случае мы применили операцию, известную за рубежом как duodenal switch, то есть это билиопанкреатическое шунтирование с продольной резекцией желудка. Операцию эту мы применяем с 2004 года, и уже таким способом мы оперировали свыше 500 пациентов.
I think from the start it has been a centre of excellence. I think that here I have never seen a team not just so skilled and so talented in what they do, but they work extremely well together. And instead of having to wait for another specialist to be involved in your care, from the start I have been able to have ultrasonography, radiology, access to nutritional information, endocrinology, anesthesiology, as well as having allied health professionals such as nursing staff and superb surgeons who are all there immediately and all communicate with each other so well. It has been the best example of care I have seen, and I'm very lucky to have been someone who received it.
And how did your first meeting with your doctor go?
Excellent, really excellent. Professor Yashkov already had all of my information, and because he's so brilliant, had already worked out what my problem was.
Можем достаточно хорошо прогнозировать эффект будущей операции именно в плане коррекции сахарного диабета. То есть мы проводим некоторые тесты, и по их результатам примерно можем пациенту, скажем, с той или иной степенью вероятности прогнозировать, насколько мы можем компенсировать сахарный диабет.
So when I met him, he was able to offer me the best approach to manage my situation, and the procedure that he offered me was particular for me. He could change slightly the way the surgery was done, so it gave me the best chance of outcome, and that's exactly what I've experienced. Yes. My son and my husband have also traveled. Yes, and they love it. They have had such a lovely holiday in Moscow. They have loved. Yes, exactly. But I don't begrudge them, because this is my chance of a new life. But they have really enjoyed the people that they have met. Have been so friendly and so helpful. When they get lost and when they have eaten out, they have really enjoyed it. And I think that that's a bonus. And I think it would mean we would come back again just for a holiday. Yes, absolutely. But even when my husband, who is also a doctor, saw the clinic, he knew that we were in somewhere of a very high standard. And that in itself is very reassuring. Because if you have a relative who's going to undergo surgery, to know that they are safe and they are looked after by someone who is so skilled, that gives you tremendous peace of mind. Yes.
You know, many Russians think that it's a big problem when you go for some treatment abroad.
Yeah.
And you don't know the language.
Yeah.
Was it a problem for you?
No.
The Russian language?
Absolutely not. And to my shame, I have no Russian, but the fluency. Well, the fluency I have met here has been outstanding. And for an example, even if people feel the treatment that they want to tell me about, they can't explain, people have actually gotten a translation service on their phone, so that they can make sure I have all the information I need. And that tells me everything. It tells me how caring they are, and it tells me how considerate they are, and it tells me how thorough they are. So from the language barrier, there isn't any. There really isn't. Yeah, no, there isn't.
Do you find any differences between English clinics and Russian clinics, if any?
Yes.
Like,
I think that this clinic has been a very good example for lots of different centres to follow. It's incredible that you can actually have care from the highest level of staff, from consultants, as soon as anyone thinks it may help you. And that's quite different to other clinics. You also see somebody immediately and they handle your care. Professor Yashkov actually walked me through every part of my care, down to radiology, down to ultrasound, down to ECG. So at every part of the way, I had a consultant, a specialist, actually bringing me through the patient journey. And that is outstanding. And his team, Dr. Dmitry, is equally as committed and caring from aftercare, every part, because if something is not as good in a result of a blood test as they would like, he explains every part of the program and walks you through and to the place that you need to go to for the next test. So at no time do you feel, I don't know what's going on, or feel in any way intimidated. Exactly. I think that this has been superb.
As I understand, you don't regret coming.
No, not at all. If anything, I don't regret sooner. But I feel so lucky, and I think that there probably are so many people in my position and similar positions who just don't know that this service is available. And I think it's only fair, because I have had such a wonderful experience, that they get to hear what happened to me, so potentially they have a chance of having a better life.
Do you plan to get in touch, to keep in touch with your doctor?
Absolutely. In some ways, it feels like a second birthday. So Professor Yashkov will hear from me, unfortunately, for a very long time, because I am so thrilled and so grateful for the care that I have received, that I have to let him know, and others, how well I feel and how well I have done.
That's really nice. And we should say that every patient is very important to the centers. I hope you have a good connection with the
Yes.
people from here. The most important thing is in good health.
Absolutely. And that really is true. It really is true. When I came to Russia and to Moscow, I really had a pain here, which is now gone. Completely gone. And although I have a wound, it's not painful. It really isn't. So already, already I feel so much better, and that I could go back to a life that's very busy and very demanding. And that's only something I can really give thanks for, because without that help, that would not have been something I would have been able to achieve.
Непременным условием вообще выполнения любой операции метаболической направленности является постоянное наблюдение за пациентом. Безусловно, в нашей клинике, являющейся центром высокого качества в Европе, безусловно, этому принципу уделяется особое внимание. То есть мы постоянно, пожизненно поддерживаем связь с нашими пациентами. Это очень важно для того, чтобы понимать, какие изменения с ними происходят, насколько, так сказать, безопасно наше лечение в перспективе. Ну и в зависимости от ситуации, так или иначе, скорректировать нужное лечение, которое должен пациент получать после операции, обязательно. То есть речь идет о витаминно-минеральной поддержке, речь идет о систематическом лабораторном контроле. Этому мы уделяем очень большое внимание. Мы надеемся, что Ориэл, вернувшись на родину, будет тоже держать нас, постоянно информировать, держать нас в курсе о тех изменениях, которые будут с ней происходить. Ну а мы, как специалисты, соответственно, будем делать из этого выводы.